Okay, members. Moving on to urgent oral question. Ms Emma Sheeran has given notice of an urgent oral question to the Minister of Health. I would remind members that if they wish to ask a supplementary question, they should rise continually in their places. The member who tabled the question will be called automatically to ask a supplementary. Clerk, please read the question.
To ask the Minister of Health, following Informing Choice's decision to cease its provision of a central access point for early medical abortions, to outline the actions he will take to ensure an interim service is in place.
Thank you. Members will be aware that there are currently a number of legal proceedings related to the provision of abortion services in Northern Ireland, including one which is before the High Court today. I am sure members will show respect for the respective rules of the Assembly and the courts and avoid any comments which could prejudice those proceedings. In accordance with the sub judice rule, members should limit their comments strictly to the subject of the question. The question is confined to the end of funding for Informing Choices NI and interim provision of services. Members will wish to avoid discussing the lawfulness of the Abortion Northern Ireland Regulations 2021, which are the subject of today's legal challenge. And I call the Minister of Health. Minister.
Thank you very much, Mr Speaker. And as you have highlighted, the House will be aware that further to the direction brought forward by the Secretary of State in July, my department had asked Informing Choices NI to submit a funding request for the cost of providing an interim telephone-based information and advice service. A funding request for £83,000 was received in August, and my officials had been pursuing this, and in line with departmental approval processes, with the intention of bringing a paper to the Executive on this matter for agreement in line with the legal advice received. This funding would have been in addition to the £137,000 that my department and the PHA already provide in grant funding each year to Informing Choices NI. In the interim, Informing Choices NI signalled their intention to withdraw the current service from the 1st of October due to funding issues. In response, trusts established an alternative advice and referral service, and as of today they have put in place an interim advice and referral service in which is being delivered by the British Pregnancy Advisory Service BPAS in place of Informing Choices. My department has been advised by Trust that BPAS will provide this service for Northern Ireland 7 days per week at no cost, and this will ensure continuity of advice and referral into the Trust CMA services, pending wider decisions on the commissioning of abortion services in Northern Ireland. Until then, women here can continue to access abortion services by contacting BPAS.
I call Emma Sheeran for supplementary question.
I thank the Minister for his answer, and at the outset I want to commend Informing Choices for the sterling work that they've done over the past 18 months when abortion was legislated for. We've had 18 months of individual clinicians stepping up. In that time, we've had 3 out of our 5 trusts having to pause services. In the Western Trust, that service still hasn't been resumed since April of this year. We have had individuals suffering and without a local service, and we had Informing Choices providing that service over the phone for local women in crisis. And at the minute, you've just outlined that BPAS are now going to be providing that interim service. So there's no local service for women, many of whom are going to be in crisis situations with no support system around them. Can you advise what local service they are going to be able to avail of in the interim?
I thank the member for the points she raised. I will indicate that BPAS is providing a service, a telephone service, the same as Informing Choices NI we're actually doing as well. So it is the same provision of advice that is being given.
I call Palm Cameron.
Thank you, Mr Speaker, and I thank the Minister for making himself available to the House this afternoon. As is well documented, the DUP has been consistent and a passionate pro-life voice. Women who find themselves in the most difficult circumstances should, of course, be able to avail of independent and non-directive advice on support that's available to them. But at the heart of this must be a balanced appreciation that there are alternative routes for pregnancy, including adoption and fostering. In light of this, can the Minister outline how the British Pregnancy Advisory Service will operate differently, if at all, from the Informing Choice NI model? And can he confirm whether an equivalent central access point has been established for pregnant women seeking to give advance consent to adoption?
In regards to the last point, I'll be covering that in comments tomorrow in regards to the legislation that I'm bringing forward in regards to the Adoption and Children's Bill. In regards to any differential between advice that would be given by Informing Choices or BPAS, there should be no differential in advice.
Nicole Carr-Hunter.
Thank you, Mr Speaker, and I'd like to thank the Minister for his answer so far. Minister, my colleagues and I met with Informed Choices months previous. It's evident that this is a much-needed service and a valued service, offering women unbiased information surrounding the choices available to them. I believe women in crisis deserve support and they deserve impartial information on the options available to them. Therefore, can I ask the Minister, will his department reassess how information on abortion services is advertised on trust websites so that women know what and where the options of compassionate modern healthcare are available to them?
I thank the member for her points raised, and I will ask the trust information that is on their websites be reviewed in regards to any changes that have been made by the transfer from Informing Choices to BPAS, so that there is access and guidance to information that can be necessary for those women who seek it, and an easy pathway for where they should contact as well.
Nicole Allen-Chambers.
Thank you, Mr Speaker. Whilst I note some members of this House and even some ministers still occasionally call on the Health Minister to unilaterally introduce a new service specification without an executive decision, but to date none have been able to produce a creditable argument that by doing so he wouldn't be in clear breach of his own legal requirement, according to the Executive's definitive legal advice, as well as the Ministerial Code. Can the Minister confirm that this is still the case?
I thank the member for his point, but taking the Speaker's direction before this question started, there is legal proceedings ongoing today, so I won't answer that at this point.
Thank you, Minister, for that sensitivity. Thank you for that. Nicole Paula Bradshaw.
Thank you, Mr Speaker, and thank you, Minister, for coming to the Chamber today. As you referenced in your opening remarks, Informing Choices NI submitted a funding application on the 20th of August. Why has it taken so long for them to get an answer in regards to that? And also, you mentioned that this is really a referral point. Are you aware of the full extent of the support that Informing Choices provides women? It's not just a telephone service, it's also the counselling and also then the non-directive care that they provide to women, in many cases directing them to adoption services, for example, as well.
In regards to bringing the paper, it was in regards to the direction that we had received, which is the subject of the legal proceedings today. We had sought and we'd actually approached Informing Choices for the funding bid, for the request, for the advice, the additional work that they were doing when they provided that business case. It was being taken through and processed by my department officials so that we could bring a paper to the Executive as is required under the Secretary of State's direction, and it was at that point when Informing Choices signalled that they intended to withdraw their current service. The trusts engaged and worked with BPAS to provide the same service at no additional cost. In regards to any differential in what Informing Choices is asking, they are still funded by my department to deliver a level of service to the women of Northern Ireland and those who seek support and guidance, and I'll check to make sure there is no disparity in regard to either what they're continuing to provide in regards to advice and provision for those women, and regards to what BPAS are providing in regards to what both organisations are now delivering.
Call Claire Bailey.
Thank you, Speaker. Minister, I want to declare an interest first as a board member of Informing Choices NI. So I don't want to go into the specifics, but you did mention that they put in a funding request of £83,000 and then made a comment that BPAS are now going to take up the service at no cost, which I think is maybe a wee bit misleading because it is a cost. It's a cost to BPAS, who are a charity, maybe not a cost to your department. And then this, of course, is also on top of the cost to the Women and Equalities Committee or Department at Westminster, who are also covering the cost of women from Northern Ireland who are forced to continue to travel to access treatment and care in England. So have you or your department done any assessment on the cost that others are picking up that Northern Ireland Executive are failing to deliver?
And I think in response to the initial question in regards to the provision of support that Informing Choices were given, the BPAS is now picking up. Informing Choices had put in a provisional bid for £83,000 in a business case to provide that. BPAS, as the members indicated, is picking that up at no additional cost to myself or our department, and as much as a challenging funding place for the Department of Health. But I do want to play, and the member has indicated before in this House that she is a director of Informing Choices NI, and I want to note the vital role that they have provided in Northern Ireland, and that's why my department and the Public Health Agency does provide roughly £137,000 a year in funding Informing Choices, and that funding supports the provision of free sexual health advice and the counselling service and literature on a range of issues for people who are often young, vulnerable or in crisis, and that includes contraception, STIs, as well as sexual health and relationships education for people with learning disabilities as well.
Thank you. I call Jerry Carroll.
Thanks, Mr. Speaker. When you Google Abortion Services NI, one of the first organisations to come up is a discredited, biased and anti-choice organisation. So I want to ask the Minister, in light of this decision around Informed Choices, what steps will he take to ensure that women here are aware of abortion services that are currently available locally and ensure they are able to access information that is both safe, accurate and reliable?
And I thank the member, and I think that goes back to Ms Hunter's question as well in regard to the information that's available in Trust websites as per direction. Google search engines are not within my scope, but I think it is important that our trusts are providing the signposting and facility for what is crucial services and advice lines as well.
Call Matthew O'Toole.
Thank you, Mr. Speaker. Just to clarify, Minister, is it your position that women should be able to easily access legally provided abortion services in Northern Ireland, and that information should be as easy for them to access as possible? And secondly, would it have been your preference that Informing Choices, who in my view have done an extremely professional job, in the view of lots of other people, at providing this service over the last period, that they should have continued doing it? Would that have been your preference?
In regards to my preference or not, Informing Choices, when they signalled their intention to withdraw their services as of from the 1st of August due to funding pressures, and a bid that my department officials were working up into a paper to produce to the executive as per the direction requires us to. It was the engagement of the trusts where they picked up and engaged with BPAS and provided that provision of service and advice to women that actually meets what Informing Choices were doing. So there's a continuation of advice and services there as well.
And members, that concludes the urgent oral question. Members, just to make a very brief announcement, as you know, the Minister of Justice was unable to attend question time in the Assembly today. The Business Committee has agreed a revised order paper to show question time to the Minister of Justice to take place tomorrow at 2:45. And item 7 on the order paper is the adjournment. The question is that the Assembly do now adjourn. The Assembly is adjourned. Thank everybody very much.